Convert CBCT data. Initially, you're going to go to the top left and you're going to click on New. And then you're going to move the cursor down to Create a new plan. You'll continue. And then you're going to go to the Import DICOM folder here. And we can set it up to where I believe the raw data, or it should be, is saved somewhere on your network server. If not, then we can work with your IT person on that. But we can set it up to where when we look to import it, it's going to look to the folder where that information is being saved to. So we'll select the DICOM information. It's going to be multiple single slices, and the interval you'll see here, this one's 0.25, but ideally we want the slice interval to be 0.3 to 0.5 slice increments in multiple slices. And then on the bottom right, we'll hit Next to move forward in the software. As you'll see here, you'll take the cursor up to the corner of the image where it is grayed out, and then slide it up. And what we're doing here is editing the 3D image. All the raw data is still there. We're just editing what we see in the 3D image. The next part we'll go to is the setting the occlusion, and you'll see that there's 3 slide bars, one in the middle, one on the bottom left, and one on the right. That is how we either tilt left or right, frontwards or backwards, and being able to line up the occlusion. We just wanted it approximately close to where the occlusion is. And then you'll see on the upper right where it says select the correct jaw type. Whichever jaw we're treating, that's the one we're going to select. So it'd be either upper jaw or lower jaw. You can see here using the middle slide bar to move it up and down, frontwards or backwards on the bottom left. Select the correct jaw. And then on the bottom right, we'll go to what's called patient mask, which is like basically we're editing the 3D image, and if there's scatter, whatever we want to remove. On the left side there, you'll see a little icon that says keep largest part. That works here and there. It just depends. I make a little bit on those ISO values. So once we're in that area and we hit keep largest part, most of the times it works. But if it doesn't, you'll see here on the left side there's an icon that says cut. You'll select that, and then you can literally make points around the areas that you want to erase from the 3D image. If you've got metal restorations, a lot of times you just cut the teeth off, basically right at the bottom of the teeth, and keep the roots in place, and then remove those from the 3D image. So once we finish, it moves us into the planning software. What we did here is the flow of the software is going to be from left to right. So you've got patient, prosthetics, diagnose tab, plan tab, finalize. As we move through the sequence of things, we're going to always start on the left side with the patient. And basically we're preparing to start planning the patient. We're preparing the 3D image, we're setting the reslice curve. We're just getting the images ready to get ready for planning. We can also change what the image looks like, and that's the transfer function area here you'll see. That gives us an X-ray view, a natural bone view, and several other views, whichever one we feel is most appropriate to be able to plan the case. In utilizing the reslice curve, you'll see here they're using the scroll bar at the bottom there to scroll through the different axial slices. We want to be basically right in the middle of the tooth to set the appropriate location. This is important for the view of using the panoramic view. If we have it set in this location here, our panoramic view is going to be much more accurate. And then bottom right, we'll click Finish. If we're ever in within the software where we're initially converting that CBCT information, if we ever feel like we're stuck, I always tell people, look bottom right. It's either going to say next or finish. It's going to move us through the software. If you ever feel like you're stuck, always look bottom right. And here they're in the transfer function area, selecting what type of 3D image they want to utilize for planning. I'm going to go back to the initial CBCT area where we were cropping the information. Within this window, you'll see in the bottom right where they have the 3D image of the patient's bone, and there's a slide bar with an orange color right next to that slide bar on the bottom right. If it feels like we have a fair amount of scatter with that image, we can pull that slide bar to the right, and it'll reduce some of the ISO value and reduce the scatter that we're seeing in that 3D image. If we get the Smart Fusion to fail to line up, that is something to where we'll reduce those ISO values down to where the only thing that we can see are the restorations in the patient's mouth.